vaccine. That's what we need now. The vaccine is going to solve everything. And I have a feeling that in a few months' time, people are going to say, oh, firstly, it's exactly the same scenario. Public confidence is very low. Whether it works on it is very much up for debate. It's like the track and trace cost billions of pounds. And it's one of these things, I think in a few months' time, people are going to say, oh, forget about it. The vaccine didn't work. It's not working. And now they're going to have maybe some other quack cure that Johnson's going to somehow be able to procure, maybe from one of his friends again. And I was saying to my wife, I said, the difficulty is now it seems like we have the worst of both worlds. We have strict lockdown now and extremely high coronavirus cases. So nothing's good. We've made no progress, essentially, in the coronavirus thing. And I think, I don't know, it's one of those things like people want to point the finger of blame at Johnson. And I think in some ways he can be blamed. So I think in the sense that, in my opinion, if you are someone who is a leader, if you want to kind of express the characteristic of leadership, you make a decision and you stick by the decision despite the public outcry. Basically say, okay, we've had this policy. So their policy was herd immunity. Fine. Not pursued by any other country, or Sweden to some extent, but nonetheless, that's your policy. So the coronavirus arrives, people start dying. You say, that's all fine and good. We have our policy and we're not going to change it. And then, because no country actually took that approach, no one actually knows what the consequences would have been. But then he obviously went back on that. Another mistake was that, and I think by far the most egregious mistake of all, is that he had older people who were living in care homes and hospital, and he sent them back to the care homes to, spread the virus in care homes, which is where it's most prevalent and the place also where most people who catch it die. But apart from that, I just feel that there's no European country. I mean, I know comparisons are made with Asian countries, and I'm not sure how apt those comparisons really are, because firstly, we're very critical of those countries for being too authoritarian. Secondly, I have no idea that we have any cultural similarities with them at all. I mean, I don't know that it's directly comparable in any way. And thirdly, you suggested that it might not even be the same strain of the virus, so I'm not sure those comparisons are really good comparisons. What I can say is that we are very similar to other European countries, and I don't see any European country with no cases, virus is gone, everything's perfectly fine. We're all in the same boat, more or less, and it's just varying degrees of seriousness. So then I think, well, given that everyone's in the same boat, irrespective of the government or the people in charge or whatever, how is it that you can then criticize an individual, in this case Johnson, solely for the mistakes that he's apparently made?
Well, I think for the reason you just said, because he's gone from one harebrained scheme to the next, seemingly. I mean, I think you characterized it earlier as it could be a comedy in which somebody wants to make a living, but they just go from one get-rich-quick scheme to another, and then it's like it could be a joke, right?
Yeah.
But it's not a joke because it's very serious. I think... look, I mean, going back to what we were talking about earlier, the exercise that they did in 2016, which I guess this report was suppressed until recently or something, or nobody paid any attention to it, which showed that if there were an epidemic in this country, the health service would immediately be overwhelmed. I mean, one of the things they don't say is, yes, if you watch the documentary that's been on now for a few years running called Hospital on the BBC, you will see that 2 cases that need to go to the ICU are going to overrun the hospital. I mean, the health service was in a tremendous crisis before this hit, and they knew that. Now, it may be just, and don't forget, we weren't trying to save elderly people by locking down. I mean, some people may have felt that would be a side benefit, but the actual reason we locked down in the spring was because we were trying to save the health service from being overwhelmed.
Exactly.
If that had been a report in 2016 that had been taken seriously, and this had been taken seriously and been prepared for, I think we might have had a better prepared health service.
Yeah.
And we knew from even people like me watching the documentary, knew that the health service couldn't possibly be prepared for any demands of extra capacity. And that's what they knew a pandemic or even an epidemic within this country would have caused.
Yeah.
So it was ignored, and I think that for that, the government should be blamed. Now, it is true that successive governments have defunded the health service, going back to 2012, to the Labour government and the Health and Social Care Act, which began to privatize bits of the health service and take money out. And I think, yeah, I mean, if you go back to 2012, that was one. I mean, there were, obviously it goes back to Thatcher as well, but 2012 was one of the most important dates in what we come to see now. And so successive governments have been responsible for this. To lay it all on Boris Johnson now would be unfair. But surely this was something that has been known for a long time. I'm sure people knew this before 2016, but certainly in 2016 this was proven. And now we've got the result of it. So maybe what other European countries have, even though no one has kind of fought off the virus and it's just keep going in waves everywhere, maybe what some European countries have that are not in such an emergency situation is better provision of healthcare for their citizens.
Imagine, yeah.
We have a fantastic health service. What we need to do is give it more money so it can actually perform better. What we need to do is support it. What we need to do is make sure that the structures and I'm not an expert on this, but I can see, even as a layperson, that the structures within the health service that support public health have got to be strengthened, fortified, and properly funded. Why do we have the Nightingale hospitals when we don't have the staff to use them?
Yeah.
So here they sit, again, empty, while the health service is overwhelmed. Again, another get-rich-quick scheme, another crazy idea, and that costs fortunes.
Always costs
if
so
all
much
the money
yeah.
that we put into harebrained schemes since this thing started and got into the health service exclusively to add real, I mean, okay, maybe, the problem is, we also left Europe and lost a lot of our healthcare workers, right?
Only now. I mean, not last year when the coronavirus started.
But people, Europeans who were living in this country have been preparing for this for a long time, since 2016 as well. And a lot of them left because they didn't feel they'd be welcome here.
Yeah,
so we have lost healthcare staff, and new ones didn't want to arrive in all likelihood.
Yeah.
Because they didn't know that their status would be, would be unstable.
Yeah.
So, I mean, every mistake that could have been made in Britain has been made. Every bad decision for the health service that could have been made has been made. And all the money you talk about rightly that's been sunk into schemes could have been sunk into providing more, better care for people who would become ill. Now, of course, in the beginning, we didn't know what would save people. We don't use respirators as much. Doctors have learned a lot. They're saving more people than they used to.
Yeah.
But we still have a problem with the elderly. We still have a problem with people in deprived communities. And the same thing is going on in the United States, where they have a much worse intentioned health service. At least here, we have the intention to help people, which is admirable.
Yeah.
But we have the actual structure to help people. But in America, it's just disgusting.
Yeah.
But these new strains, I mean, they're going to keep coming. All we can hope for is that they're not going to be as virulent as the first ones or the second ones, that they're actually going to, maybe they'll become the cold.
Yeah.
And they'll infect people more easily, but they won't kill us. I mean, who knows?
Yeah.
The program of the vaccine, I agree with you. I think there's going to be a very less uptake of it much less uptake to it than what is actually going to be needed to create the herd immunity that you need with the vaccine.
Yeah. I think that's right.
Because there is no trust.
Yeah.
And the vaccine, I mean, everybody now knows that the vaccine was rolled out quickly, and even if it's perfectly safe, there seems to be very little way of convincing the public that is some kind of certainty.
Yeah. And I mean, they're not even 100% effective as well, as the other problem. I mean, there are so many things. Firstly, that it's going to take such a long time to roll out. You need 2 doses. Confidence isn't high, and it's not like guaranteed. I mean, because by virtue of the fact it's only just arrived, it's experimental. I mean, you can't say it's the same as a vaccine. The ones you get for when you travel to Africa, and they've been around for ages, and they know they provide immunity. Yeah, exactly.
And the British gap, and then of course again the British gap, another innovation of Britain, the first country to start using the vaccine, another crazy idea, and then the gap of 12 weeks, which no manufacturer recommends, but yeah, well, we're going to do that.
Yeah.
People say this isn't true, but I mean, obviously a lot of people have read in the newspapers that and this is going to need reassurance for the public as well, because the story that's been out there is that if you get the first jab and they don't have the same one available when you come for the second one in a crazy 12-week, arbitrary 12-week period later, you might get another one. And as far as I understand, they don't all work in the same way.
Yeah,
or maybe they don't have a record. I mean, unbelievable of what you've been given the first time. I mean, these things sound unbelievable, and maybe they're false, but these are the stories that are out there, whether you like it or not. And the public needs to be reassured. And I don't see Boris Johnson as the man who seems in charge and reliable and is going to be capable of reassuring the public.
Well, I think the other thing is that no other comparable country is pursuing. I mean, I guess America has some sort of vaccination program, but I'm not aware that any of the European, the European ones are.
They're using the Pfizer vaccine now in Europe, but I don't think any other country has an arbitrary 12-week lag between that, because all the manufacturers have, recommended that the second jab comes sooner. But in this country, we want to get as many people have this is another Boris Johnson fantasy.
Scheme,
as many people get the first jab as possible, and then we'll worry about the second one. But even though we know it's not even 100% effective when you have the second one.
Yeah.
Now, maybe I'm an idiot, and I am. I mean, maybe I don't understand the thing, but I'm an average person in the public, and I'm hearing things that don't make me feel...
Yeah.
And I'm a very pro-vaccination program person. I'm not an anti-vaxxer by any means. I mean, I get all the vaccinations. You guys, all of my children have had all the vaccines. I've never been against vaccination programs. I think they're great and necessary. But I mean, even I'm sitting here thinking, what's going on here? This is like a big rush for something that we don't even... And then Chris Whitty is talking about restrictions in the winter again next year.
Yeah. I mean, I was looking with someone earlier also about the fact that I think the impact of the coronavirus is very directly related to the kind of society you have and the kind of trust and sort of coherence people in society have. I mean, which also goes back to the measures that are introduced, because I think in this country, to a great extent, because the measures have changed so much and because people are so unclear about the rules day to day, people have also kind of lost faith in even respecting the measures that are introduced. Which means no matter what the government says, and they change constantly, people are just like, well, I'm going to be fine, that's great. I mean, obviously I'll still take precautions, but I'm going to continue my life more or less as normal, because from one week to the next, it's one thing and it's another thing. So, and I think the countries that have been worst affected by it are, or must be, like Britain and America, which doesn't mean to say that those societies are uniquely bad. I was saying, there are positive things as well. I mean, people like to come here from abroad because, there's a lot of anonymity. You can basically do whatever you want. You can make money, all this kind of stuff. But what it means is when you're confronted with a national crisis that affects everyone, I won't say equally because there's some evidence to say it doesn't, but I mean, anyone can get the virus. Boris Johnson himself got the virus. So when you have that sort of situation where society has to come together, you can't. In Britain, it just breaks down, and the United States as well, because no one has any faith in society. Society's dead.
I think the first lockdown, maybe I'm going by my own experience and where I live, but I mean, it seemed to me like the first lockdown, people were quite happy to comply with the rules and think that we were helping the NHS, and we had a kind of
they did, definitely.
Yeah, we had a kind of a, we clapped, and we had a kind of an idealistic sort of, let's all get together, the spirit, the war spirit. Of course, there are always people who are going to be suspicious. I mean, when you don't understand, a lot of this comes down to motivation. Like the Christmas thing, even in very simple ways, you don't have to be a conspiracy theorist. Even with the Christmas thing, you think about, okay, what were they doing? Or what was Johnson doing? He didn't want to cancel Christmas. So he did it and did it and did it, and then ended up having people go out and buy their turkeys and their Christmas trees and plan for their 3 households, and then say, no, sorry. And then have